The South African National AIDS Council has called for extra vigilance as lockdown level 3 continues and says that preventing HIV is still important. South Africa has a very high rate of HIV infections and the largest antiretroviral therapy program in the world. The SA National AIDS Council, SANAC, brings together government, civil society and the private sector to respond to HIV, TB and STIs. To discuss, we're joined by the CEO of SANAC Coceka Nogoduka. Ms. Nogoduka, thank you. Firstly, there's been a huge concern that access to clinics to get drugs may be curbed. How has COVID-19 impacted on those living with HIV/AIDS?
Good evening to your viewers and good evening to you. Yes, as SANAC, working with our stakeholders, we've got to understand that during lockdown, as you would understand that the approach that government took in terms of flattening the curve was to implement lockdown regulations, and one of those regulations was to restrict movement. So people were restricted in moving around to go to health facilities to collect their medication. But also, as we were battling with the virus, we saw healthcare workers infected, and that meant some of the health facilities had to be closed to be fumigated. So that impacted quite a lot on our patients currently on treatment. So we had to devise an approach to make sure that we address the issue. And as you would be aware, in the past couple of years as the country, we launched a program that is called CCMDD, which is a chronic medication dispensing program. And we've worked with government and aligning also with the WHO guidelines. We have now announced a multi-month scripting of ARVs to ensure that our patients get 3 months supply of drugs, but also that also reduces their going to the health facilities. Yeah. So that's how we've tried to combat the challenge of COVID-19 on our patients.
And is it working? Do we know that patients who are taking antiretrovirals are continuing with those drugs? Nobody's dropping off because of a lack of access now?
It is working. It's working because you would remember the CCMDD program does not only work for clients to go and collect medication from health facilities. You can collect it from the ShopRite pharmacy, you can collect it from the Clicks pharmacy, you can collect it from Discam, and also you would remember that there were support groups that were established at the beginning of the program, so that those that are on support groups can get their medication from the support groups. So the CCMDD program is really taking patients out of a facility and back into the community and making sure that those that are stable on treatment continue to take their medication. So we are comfortable that patients that are on treatment are getting their medication and are adhering on their medication.
All right, now you're concerned that maybe the message about the prevention of HIV, also very important, possibly getting drowned out. What's the situation at the moment?
Yes, you'd remember our HIV prevention programs were mostly community-based, where we were, even for HIV testing, we were doing outreach programs in taxi ranks, in shopping malls. Our HIV prevention commodities like condoms, we would then be distributing them from health facilities. So the COVID pandemic has really gave us an opportunity to reprogram and redesign our HIV and TB prevention programs. So we've looked at how we can do these programs online. We've also looked at how we do these programs. I mean, for example, for the HIV testing, we've introduced HIV, or we've strengthened the HIV self-screening test, which is more like a pregnancy test. You can get it from a pharmacy, you can get it from a health facility, you also can get it from your community care worker, and you can test yourself. And then there are instructions on the test kit on how to connect with care if you are then positive.
All right, thank you so much for your time tonight, CEO of SANAC, the South African National AIDS Council, Coceka Nogoduka. All right, let's go back to the memorial. This is spearheaded by the ANC. Remember